Progress in sanitation requires continuous learning, adaptation, and collaboration across cities and countries. And that is exactly what today's session is about, bringing together shared experiences to better understand what is working, what needs to evolve, and how we move forward together. Good morning, good afternoon, and good evening to everyone joining us from across Asia and beyond. You are all welcome to today's webinar session. Allow us to pause briefly for more participants to join. And as we wait, please, those who are ready, moment to introduce yourself in the chat, share your name, your organization, and where you're joining us from. Yes, it's great to see so many of you already connecting, and thank you for taking time to be with us today. Once again, a warm welcome. My name is Florence Lake from the International Water Association, and I'm pleased to introduce today's webinar session that is CWIS current status and future priorities, focusing on insights from Asia. This webinar is the second of the CWIS webinar series that is hosted by the International Water Association in collaboration with the Sanitation and Water Middle-Income Countries Specialist Group, as well as Center for Water and Sanitation, that is Center, Asian Institute of Technology. Today's session is an opportunity to reflect on how far we've come with citywide inclusive sanitation, what we are learning from its implementation across Asia, and importantly, what agenda beyond 2030. And to help ground this discussion, today's conversation draws on insights from a recent global consultation, which I will briefly introduce in this slide that's currently showing. Over the past year, the international partners conducted a global consultation on the current status and future directions of CWIS. And this process brought together perspectives from across the sector, including development agencies, utilities, local organizations, networks or associations, and knowledge institutions. And the aim was basically to understand how CWIS is being applied in practice, what is working well and where challenges remain. And this consultation focused on three key thematic areas: lessons learned from implementation, the key factors to accelerate progress towards safely managed sanitation for all, and priorities for sanitation beyond 2030. And the findings have been synthesized into a global report, which will be published soon. Today, we just would like to focus on what these insights mean for the Asian context. And so before we dive into the discussion, let me briefly share a few housekeeping notes. Please note that this webinar is being recorded, and the recording along with presentation materials will be shared on the IWA Connect Plus platform, as well as the IWA website after this session in the coming weeks. We also hope that this conversation today from today will continue beyond and reach a wider audience. Please also note that the views expressed during this session are those of the speakers and do not necessarily reflect the official position of the International Water Association. Again, a quick note on how we shall engage during the session. We encourage you to actively participate throughout the session. Please use the chat box to share comments and reflections, and the Q&A box to submit questions for the panelists. Our team will be monitoring and curating questions, and time permitting, we will bring some of these into the Q&A segment. Please note that the microphones will remain muted, and the raise hand feature will also not be used. So interaction will take place through these channels I've just mentioned. So with that, we are ready to begin. It's now my pleasure to hand over to our session moderator, Asim Mansuri, who will guide us through the rest of the session. Asim is the principal researcher and center head strategy for the Center for Water and Sanitation, the CWIS, with over 15 years of experience in CWIS, climate resilient water systems and development programs across India, Nepal, Bangladesh, and Zambia. Asim, over to you.
Thanks, Florence, for the introduction, and thanks for setting the overall context of this important webinar about CVs in Asia. So it's my pleasure to welcome all the guests, all the participants. Good morning. good evening, good afternoon to all of you from different parts of the world. It's good to see a good turnout for this webinar. Now let's straightforward jump into action. So I would now like to invite Jitendra Kumar Singh. He's okay. I'll go to the agenda first. So I think we are having some welcome remarks from Jitendra and Sangam. Then we will have a session by Juliet where she will be talking about the findings from the study. We have some polls. We wanted this to be a more interactive session, so we have kept some polls for the participants to reflect upon what thoughts they have around CWIS. And then we have Isha who will present about urban sanitation status in Asia based on their work done at GWSC. We then have a very esteemed panel members from across the Asian countries who will be talking about the CYC. And then we have another reflection poll and a closing by a colleague from World Bank. So this is a broad agenda for the day. Hope you all have a good time in the discussions in the webinar and you find this discussion useful. So now I'd like to invite Jitendra Kumar Singh. He's a water supply and sanitation specialist at the Water Urban Development Sector Office of Asian Development Bank. Over to you, Jitendra ji, for your opening remarks here. Thank you.
Thank you so much, Asim. Good day, everyone. And thank you for joining this IWA webinar, CWIS Current Status and Future Priorities, Insights from Asia. It's a great pleasure to be part of this discussion today with such a diverse group of practitioners, partners, and institutions working on citywide inclusive sanitation across this region. In the last 15 years, ADB has invested $3 billion in sanitation, incorporating the principles of CWIS, which translated into the beneficiary number of around 22 million plus. As we reflect on the current status of CWIS in Asia, it's useful to look beyond these numbers, headline indicators such as access or coverage, and instead consider where cities are positioned along a broader CWIS maturity pathway. This includes not only infrastructure, but also governance arrangements, service delivery models, and financing frameworks. From experience across South and Southeast Asia countries, we often see uneven progress across these dimensions, where technical solutions may advance faster than institutional or financial systems. Recognizing this unevenness is important because it shapes how we assess progress and how we define realistic next steps. The Asian Water Development Outlook, Order 2025, the report which we launched during IWA Congress in December, emphasized that governance in the region needs greater focus. When we turn to future priorities, a key question is how these ambitions translate into practical delivery choices on the ground. Many cities in the region now have a strong policy intent around CWIS and a growing body of pilots and technical assistance to draw from. Yet, persistent challenges remain around institutional clarity: who is responsible, who pays, who operates, and how services are substantially and sustainably financed and maintained over time. And those are the places where we see some gaps. In many cases, these become the binding constraints to moving from fragmented interventions, which we are continuously doing, to truly citywide inclusive services. I hope today's discussion also creates space to reflect on how CWIS partnerships in Asia need to evolve going forward. Many of us have collaborated on pilots, studies, and demonstrations. We extend our sincere appreciation to the Gates Foundation for their current central role in bridging us and binding us together and enabling significant adoption of CWIS principles into our projects. As the agenda shifts, scale and system level change, the next phase will likely require deeper and more meaningful collaboration with utilities, municipalities, and national institutions, so that CWIS principles are not only demonstrated, but embedded into planning, financing, and investment decisions at a greater scale. With that context, I very much look forward to the insights from our speakers and the panelists and the discussion that follows what the current status tells us and how we collectively shape future priorities for CWIS in Asia. Thank you so much.
Thanks a lot, Jitendra ji, for setting a great context about why this webinar is important. And you raised very important points about looking beyond pilots and looking at citywide sanitation and moving beyond infrastructure. I think that is very important. Infrastructure is there, but how do we now talk about governance and service level improvements as a part of CWIS is a great point to take forward. So thank you for that context. Now I'd like to invite Professor Sangam Shrestha. He wears many hats. So he is a dean at School of Engineering and Technology. He's a professor of water engineering and management at AIT, Thailand, and he's also a co-director of the Global Water and Sanitation Center. Uh, Over to you, Professor Sangam, for your welcome remarks. Thank you.
Yeah, thank you, Asim. I think I want to correct the affiliation. I just finished my dean's tenure, so I'm no longer dean now. But anyway, good afternoon, good morning, and good evening to everyone joining from different parts of the world. It's my great pleasure to welcome you all to this webinar, and especially I want to thank IWA and all other partners for bringing together the experts, practitioners, and policymakers for this timely discussion. I think all of us know that we are off track in achieving SDG 6 and especially SDG 6.2, which is providing access to um, safely managed sanitations to everyone. And if we talk about Asian region, I think the access has improved, but still there are 35 to 40% of the population they lack safely managed sanitation services. And um, the report from UNICEF says that open defecation has declined significantly, which is encouraging, but the real challenge today goes beyond the access. And the issue is no longer just the coverage, but how the systems performs. And this is where this citywide inclusive sanitation or CWIS becomes essential. And CWIS is not just about choosing between sewage and non-sewage sanitation systems, but it is a system-based approach that ensure all urban residents, especially the most vulnerable, they receive equitable, safe, and sustainable sanitation services. And it connects the entire service chain from containment to treatment and reuse. So in this way, CWIS directly supports the achievement of SDG 6.2 by focusing on inclusion, service quality, and sustainability at scale. Nevertheless, advancing CWIS requires a few critical enabling factors. I think Jitendra has also mentioned in his welcome remark. First is institutional coordination across city and national levels. Second, sustainable financing models that support long-term service delivery. Third, reliable data and digital systems for informed decision-making. Fourth, capacity development for local institutions. And above all, we need very strong partnership. At the Global Water and Sanitation Center of AIT, we are working to support these elements across the Asian region, especially with the supports from the Gates Foundation, Asian Development Bank, World Bank, and many other development partners. GWSC collaborates with governments, international financing institutions, and partners to advance system-level CWIS implementation. And our work spans technical assistance, sanitation strategy development, strengthening fecal sludge and septage management, and promoting digital solution. We also play a bridging role, linking governments with financing, connecting data to decisions, translating knowledge into practice. Through these efforts, we have already leveraged about 500 million US dollar and influenced over $1.5 billion investment in sanitation. And most importantly, it reaches to 124 communities and about 530 million beneficiaries across the region. But I think we need to do more. So I want to conclude with a call to action. We should move beyond pilots and institutionalize CWIS. We should also focus on service outcomes rather than just infrastructure. We should also strengthen regional collaboration and cross-learning and ensure that no one is left behind. I hope today's discussion will generate valuable insights and strengthen our shared efforts toward inclusive and resilient sanitation systems across Asia. I thank you and I wish you a very productive session. Yeah. Thank you.
Thanks a lot, Professor Sangam, for highlighting important points and raising the call to action where you added one more element around regional partnerships and collaborations, because it is very truly said that if you want to go far, you have to go together. So that's a very valid point that you have raised. And you raised a very valid point about SDG being to be attained through CWIS. And one more element that we wanted to add was that SDG, that our work under CWIS also impacts SDG 5, SDG 13, SDG 11 and 17 to some great extent. So it's good to see CWIS also entailing other SDGs beyond SDG 6.2. So thank you for raising that points. Now with that context setting and welcome remarks from the esteemed presenters, I would now like to call upon Juliet. Juliet, have known her for very long now, and it's good to see you here again, Juliet. Juliet is a research director at the University of Technology, Sydney, Institute for Sustainable Futures. So over to you, Juliet, to share about the CWIS current status and future directions. Thank you.
Thank you, Asim, and thanks to Chandra and for the opening remarks from both of you. So I'm going to share, as Asim mentioned, some of the findings, at least some highlights from this recent global consultation. There's a much longer report where you'll be able to read more details very soon. And with this work, we want to start from the basis of having a common understanding of what is CWIS. And so the definition we're working with in that consultation and in the sector more broadly is that it centers the public sector. So it's a public service approach to planning and implementing urban sanitation systems, working towards achieving SDG 6, because as we heard, we are off track. We need to move more to be on track, and that public service approach should serve people irrespective of where they live within a city or what type of technologies serve them. And so that brings together a few different elements. It's a holistic, integrated approach. We're trying to unify service management across different technology types and along the whole sanitation chain, making sure that the mandates and responsibilities are clear, making sure there's accountability, and making sure, as we already heard, that there's financing available ongoing. And a key aspect is an equity focus to make sure that everyone is reached. So I'll be sharing the findings which cover the acceptance of CWIS, the relevance, and the evidence that we have of effectiveness, as well as its scalability. So the global consultations were across both global actors, but also different regions. You can see here that it covered Asia, South America, and Africa, with 16 interviews from the Asian region. And then moving on, we can see that the different respondents were both funders, development partners, knowledge partners, networks, and in-country stakeholders who were often either utilities or authorities responsible for sanitation. So a wide range of perspectives. And the first part that I will present is some highlights from the findings. And these, I guess, follow the logic of the report, and we'll start first with talking about acceptance. So CWIS, what the global consultation found is that it's very broadly accepted globally. And that was particularly true in the consultations with African stakeholders and also parts of Asia, and including some countries where there was the strongest acceptance, such as Bangladesh and Nepal. And what was found was that sometimes the name was key, and having a name with an approach was a way of starting a new and different conversation about sanitation. But in other countries, CWIS as a name wasn't needed or necessarily helpful. And instead, what was important was the principles of CWIS and finding ways to embed them in the existing government systems. And so what was found was the places with most acceptance were the ones where there was good alignment with national and local policies. And that was true in several African countries and also in Nepal and Indonesia. What helped for promoting CWIS as an approach and promoting its adoption was this idea that development partners and funders were all aligned on a single approach, that they weren't instead implementing approaches with different names or different principles, but were all aligned. And also another support to promotion and adoption was having very context-specific efforts around knowledge sharing and capacity building. And in this region, the Asian Development Bank, IWA, CEPT, AIT, there have been many actors who've played very vital roles in supporting acceptance and understanding of the approach. Sometimes people found it difficult to understand at once because it's covering a lot of different dimensions, but over time, those knowledge institutions and networks have played a critical role in evolving people's understanding. So then moving on to understanding what was understood to be the value or the relevance of CWIS. Is it really useful to help us to get to SDG 6.2? And what we found was that yes, from across these global stakeholders, CWIS really was viewed as transformative and unifying. But as you can see in the visual on this graph, if we look at the dots for the respondents from Asia, there were definitely mixed views. And some people thought it was very much fit for purpose and what we needed for SDG 6.2. Other people less convinced. And in general, those that were less convinced were people who felt that it wasn't necessary, that already we have many approaches to sanitation and we didn't necessarily need a new acronym and a new name, but in general, there was still agreement that the principles of the approach were needed and important. Moving on to the next slide. So when we dig underneath about, well, what was valuable, what made it relevant, the three top most repeated findings from stakeholders was firstly, its focus on equity and inclusion. It meant that that could be the priority, that we were no longer just focused on the richer parts of a city or the commercial areas, but that we were focusing on this universal access. Second point was that it could be contextualized. The starting point was wherever a city began, and from that point, you could adapt the approach to what was needed in that city. And lastly, that it was a holistic approach, that we're looking at the whole chain, we're looking at the institutional capacity to sustain the sanitation chain. And these, apart from these three main valued principles, there were other benefits that stakeholders talked about. They said that some people said it broadened their perspective and realization of just how many dimensions there were to urban sanitation. It fostered the coordination that we heard our earlier speakers mention, and it was also helpful just for raising the profile of urban sanitation as an area that needed work and that there was a workable approach to start working on it. Next slide, please. So moving on to what evidence did stakeholders feel there was for effectiveness? Well, we found that broadly there was a feeling that it was game-changing, but not that we necessarily had huge amounts of evidence of new access to services. And there's a reason for that, because that takes time. If what we're working on is the whole system as a whole, then it's elements like strengthened governance systems and accountability that are a starting point. And there were many examples across Asia, in Nepal, Bangladesh, also in Indonesia, of where responsibility or accountabilities had been strengthened through use of CWIS. And those are precursors for then later being able to increase access to more equitably to larger populations. A second area where there was definite evidence was a change in mindset, that people, especially engineers, who had always thought that sanitation was a technical affair, realized and walked out of meetings, walked out of workshops, worked out of processes that they were involved in CWIS, realizing it was actually a much bigger picture about how different actors, the service providers, the service authorities, the national government, these different interlinking actors, about how they function together as a whole, and realized that it wasn't about just building sewers. And lastly, the prioritization of equity. We found evidence and examples where innovative financing, for example, in Bangladesh had really targeted the urban poor, and that we were starting to see evidence that equity was being prioritized. Next slide, please. So the last element of the consultation focused on scalability, and it asked the participants, is CWIS scalable? And in general, the responses said yes. And many people actually said, well, why are you asking me that? It's already been scaled. And some of the aspects that supported scalability were this focus on governance and systems, because that means already you're working with a whole city. You're not just working with one pilot location, you're working with the city as a whole. Another reason it was seen as scalable was this ability to work incrementally from whatever the starting point was. And a third support was this knowledge sharing, and particularly by the knowledge-based institutions and networks, but also through exchanges between one country and another country, or one city and another country. So from here, we'll move on to the second part of the presentation of the consultation, which is where we really need to have our focus. That was looking back, and now we look forward. What should be the future directions? And there are 3 recommendations. The first was that the stakeholders interviewed for this report said overwhelmingly, we must stick with CWIS. It's not an acronym that should come and should go, but now that we've generated momentum around it, understanding around it, and we believe that it is a fundamentally good approach for addressing urban sanitation, we should stay with it and stick with the acronym. Next click, please. And some of the ways we can do that is by investing in continuing to socialize it, continuing to strengthen the messaging about it, continuing to build the capacity of those who promote it. We need to make sure we align on the way we describe it, because actually different organizations do describe it slightly differently, with some commonalities, but some differences. So the more we can align, the more we will keep the approach simple and clear for people to understand, and that we need some concise and very practical resources that have concrete examples that make it not an abstract concept, but actually something that can happen on the ground and amongst the different actors in a city. Next click. So it's not a blueprint. The CWIS, even if we align on the definition and how we describe it, we need to keep telling people it will look different in different cities, because every city and every country will have a different starting point, but they're all working in this common direction to have clear responsibility, accountability, and financing for these 3 outcomes of equity and safety and sustainability. Next click, please. So the second recommendation is that we need to integrate some elements more strongly whilst keeping the same line of what CWIS is. We need to address issues of resilience. We need to strengthen the integration with urban planning. We need to strengthen data to decision making in the way that we work on CWIS. So there were elements to evolve it, but they weren't about turning away from it. They were about better embedding these particular elements within our approach to CWIS. And the third recommendation was a focus on capacity. And here this can be dealt with at multiple levels. It's about university teaching, it's about consultants, it's about making sure that loans and grants come with sufficient technical assistance. I think we heard Jitendra mention that our way of measuring progress should also take into account the unevenness in institutional capacity and progress. And so a focus on technical assistance on the institutional development is very, very key. And lastly, making sure that these networks and knowledge institutions that are so important for sharing the approach, for capturing evidence and questioning and evolving the approach, that resources need to be allocated to support those institutions. And so with that, my own call to action is that we implement those 3 recommendations to continue to evolve and to build capacity in the approach of CWIS. The report you will be able to read in more detail very soon, and there are multiple other resources that can support you in your work. So look forward to the discussion from our stakeholders in the region, and thank you for the chance to share today.
Thanks a lot, Juliet, for a very interesting presentation on the findings and the recommendations. And we totally echo with the thoughts that you just shared about scaling it up. And actually CWIS hits the heart of the scale-up program, which is about governance and system change, which would actually lead to institutionalization of CWIS. In India, at least what we have seen that CWIS has been adopted, but in a local context, but it has been adopted as a wider framework. So thank you. Oh, okay. Thanks. I hope I was audible. Uh, Great. Now moving on to the next part of the discussions. I think you heard about from the welcome remarks from the speakers and from Juliet. Now we are opening up to the participants to share about their perspective of the CWIS acceptance and all. So the first poll question, I think it will pop up on your Zoom polls. Yeah, great. There. Thanks. Thank you. So this is a question. What has been the most important driver of progress for citywide inclusive sanitation in your context? So I would request the participants who all are there to please choose an option from strong national government leadership, collaborations, innovative financing, technical knowledge, community engagement, or clear mandates. You can only select one, so prioritize the top most important one. Yeah, we'll wait for some 30 seconds and then share the results with all of you. Great, we see people voting. We'll wait for another 10-15 seconds. Great. Can we have the results? Oh, great. Perfect. So I think it's a great mix of results that we have seen. But the first, I think the call of actions that Professor Sangam raised about collaborations and going together is the most voted one. So that's great. Strong leaderships do work, but with them collaboration is required. So that is a very important point. And innovative financing and donor support. That's an important element because sometimes for doing something new, we require donor support or innovative financing to finance the risk capital. And once it gets picked up, I think things started to move. Uh, Good to see this voting for the results. Now, with this poll results and all, we'll move on to the next speaker. We have Isha Baisal. I have known her long also. She is a Deputy Chief Operating Officer at the Global Water Sanitation Center at AIT Thailand. So over to you, Isha, to talk about the status of urban sanitation in Asia. Thank you.
Thank you so much, Asim, for that introduction. Greetings of the day to everyone, and thank you for joining this webinar today. It's quite a privilege to be talking to you all today on the current status of sanitation in Asia. So basically, I request to move the slides. Yes, thank you. So the presentation today that I will be talking about the current sanitation situation would be looking at definitely the coverage because that's how we understand what sanitation context is like. And also looking at from the perspective of how are we accessing these services and what is the status of these sanitation services, right? And we are all very much aware of the global numbers and figures on sanitation. And the context in Asia is also not quite different. Looking at the data from the STZ region, in Asia, we have Central and Southern South Asia and also Eastern and Southeast Asia. Both of the regions have slightly different achievements towards the STZ 6, specifically 6.2. One, we see that there is a 10-point increase, percentage increase in safely managed sanitation in Central or South Asia and South Asia. But then in Central, East and Southeastern Asia, they are able to achieve almost 0% open defecation. But what remains the same is that there is still large portion of percentage coverage that we still have not been able to achieve the safely managed sanitation. Next slide, please. So how are these the services actually being provided, in these regions? And when we look at it, what are the kinds of sanitation facilities that we are talking about? What is the trend in Central and South Asia is that we are mainly mostly focusing on the on-site sanitation systems, with only about 17% covered by seaward network. And what this shows, and the graph below shows that how much of that is safely managed, right? And it's only only 7 to 8% that is safely managed. What we see is that our fecal sludge or our human waste that is being generated is mostly contained but not yet treated. Next slide. But when we look at the Eastern and Southeast Asia context, the cities are mostly covered by sewer. Nearly 50% of these cities are covered by sewer network. But even then, only 48% of their waste is treated, safely managed. So what this shows is that it's not only about the access, it's also about what is towards the end of the service chain, end-to-end service chain. Moving to the next slide. And when we look at the overall progress of the countries in Asia, we see that none of the countries, unlike many other regions in the world, are progressing towards achieving SDG or are on track to achieving SDG 6. While we also see that some of the countries are slowly progressing, but we can also see countries which are with a negative progress or a stagnant progress. And often the question comes like, what could be the reasons for not being able to progress as we go about doing a lot of these projects and all? And finance comes as one of the key components. And looking at the financial figures that we see, and this is mainly from the OECD database, looking for only the MDB's investments for the last from 2002 to 2021 in Asia, we can see that, and I think Jitendra also mentioned that in last couple of years, the ADB has invested nearly 2 billion or nearly 3 billion of investments in sanitation. So what we see is that this is a large scale investments that's coming in Asia. But what we also do see is that we are not being able to translate this investment into the outcomes. And these investments largely so on the capital infrastructure. And it, as was described by many speakers ahead, it's not only in terms of infrastructure, but the overall system or the systems approach, which needs strengthening while we are looking to achieve SDG. So it's not an investment issue, but rather a system gap or a system issue. Moving to the next slide. So what does this tell us? Like across Asia, we see that investment is, access is increasing, investment is also increasing, but we are not being able to achieve this safe end-to-end service delivery. And this shows that while we might have increment in access, but it's not translating into safe services. We might have infrastructure, but that does not confirm or ensure we have service delivery. We are having progress, but also not. This is not being translated into SDG achievements. And also there is money that is being put in out there, but our operational results are not as equivalent, right? And so what I think this is also highlighted again and again, that it's not only the coverage gap, but also in terms of the system performance gap. Next slide, please. So what do we, like when we're talking about system gap and the approach for us, it's not going to be a project-based approach. And that's why the Citywide Inclusive Sanitation, a paradigm shift in how we do business, was also introduced, and GWSC as a platform to mainstream Citywide Inclusive Sanitation was established. So what does it mean? What do we mean by when we are talking about a system-wide approach? Meaning the working across institutions, as many have already highlighted the necessity of it, but also bridging the gap between the planning and the financing that goes into which is currently as fragmented, but also working towards that. But most importantly, linking this investment in infrastructure to service delivery, service models, governance, capacity building, and overall creating that enabling environment for these investments to be sustainable and to be bringing out the investments. Next slide, please. So overall, this is why how GWSC has been functioning. We work specifically with partners. My earlier slide did show that we have several of the executing and strategic partners through which we delivered the support. And also there's some key partnerships that we are highlighting, and we have been able to achieve these the impacts in the region. I'll not go into much detail of this, but then what does it say to towards the end on how do we evaluate and improve the sanitation situation or context in Asia? Yeah, so basically, I think I'm just saying what everybody else is saying, but and this comes repetitively because it is important that we have to look at services from end to end. We have to, from this fragmented perspective, we have to align our data, financing, and service delivery together so that we are achieving those outcomes. Building institutional capacity is a must because then only there is the sense of ownership and being the ability to run the services by themselves. For that, building partnership is a must. How we can scale sanitation through the replication and sharing of the information and knowledge that we have. So this is what I would like to encapsulate today as the current sanitation situation in Asia and the way forward. Thank you so much for listening to my presentation, and over to you, Asim. I hope I was on time. Yeah.
Yes, almost on time.
Thank
Thanks, Isha. Yeah, thank you so much. Thanks, Isha, I think, for sharing about the Asia status and also overall GWSC work. It's very insightful to see the work that you are doing as an organization, how you are collaborating with partners to create impact in this region. So with this presentations, we now open up for a panel discussion um, that we have planned. I would like to now call upon various panelists. We have Sudha Shrestha. She leads the water and sanitation portfolio in the Nepal office under Urban Basic Services at UN Habitat. We have Alauddin Ahmed. He is a program manager at IT and Duet. We have Kaveri Dhawan. She leads the secretariat at the NFSSM Alliance at Dasra, and she's also an associate director at Dasra. Uh, uh, can I call upon Dr. Dorai Narayanji? He's a freelance consultant and has worked in Malaysia and other countries as well, and has been working with various international agencies. And the last but not the least panelist, Mr. Azun Ahmed Zahidi. He is a chief corporate officer at the Inda Water Consortium Malaysia at the Malaysia National Sewerage Company. So would request all the panelists to turn on their videos and come for the panel discussion. Yeah. Thank you all the panelists for joining this important discussion around CWIS in Asia and the insights that can come. I'll start with Sudhaji first. Sudhaji, as Juliet also mentioned, and when we read through the report, it highlights that CWIS is gaining a lot of traction globally, but yet it depends on the national and the city level coordination and commitment that has to come through. So based on your experience in Nepal and through the CWIS and network that you have been anchoring, what are the enabling factors that have been the most efficient for cities to adopt CWIS in their approach? Over to you, Sudhaji.
Thank you, Asim, and thank you for being honored as a panelist. Basically, a little bit of the background of CWISAN, and then I'll go through the achievements that the CWISAN had been upscaling the CWIS approach in Nepal as well. So CWISAN is established in 2021 December, and within the short period of 3 years and few months, there had been really impactful results in Nepal as well. So CWISAN is an alliance of 22 agencies comprised of UN agencies, private companies, academia, NGOs, INGOs, and also the experts. And with this consortium or alliance, we can say it has really built up for the collaborative model demonstration as well as the collective voice for the sector as well. And in this line, we basically focusing on 3 themes like the policy and the monitoring aspects, which is led by UN agencies, UNICEF and UN Habitat, and also the capacity building part, which is led by ENFO and also the National Training Center of the government, under the government, And the advocacy part is definitely by SOFIN and WaterAid Nepal. So these thematic area that we work on has really pushed forward for the capacity building as well as the collaborative model. And what CWIS had really impacted is, well, firstly, it is the policy influence that we have been able to achieve through the collaboration with the government of Nepal as well. So in this line, we have been able to really reflect municipal-wide inclusive sanitation mandate in the Water and Sanitation Policy 2023, which has been promulgated in 2023. And then after that, the WASH Act as well. And mostly impactful one is the Water and Sanitation Regulation in 2025, which has been a series of this consultation and CWIS inputs into the drafting of the Water and Sanitation Regulation, which really had turned the regulation into the theme that water and sanitation needs to be regulated for the quality services to the people. And then what CWIS had really achieved is also the regional collaboration, where we have been collaborating at the with India, NFSSM, DASRA, and also ITN Buet and FSM Net in Bangladesh. And this had really brought the capacity enhancement, the collaborative learning, and the exchange of learning within this South Asia as well. So DASRA had initiated the learning hub, which we have been constantly linked for the learning around South Asia as well. And with ASCII, the CWIS Knowledge Hub as an online portal and online certified course, Nepal had been able to really achieve the certification of CWIS online course by more than 90 plus professionals of Nepal. And also the Sancor, which had been quite a learning for years of Nepal to adopt the actions and initiative that is taken in India, especially Hyderabad and Odisha also. And with NIUA also, we have been collaborating for cross-boundary Parvat Manthan, which is like the flagship program of NIUA and Government of India, which we are also collaborating for transboundary agenda and transboundary coordination on this as well. And also, there are lots of collaboration with ITN Buet for the capacity building and learning and the training modules that has been developed and also endorsed by the government of Nepal. And now we are rolling that out into the through the National Training Center under Ministry of Water Supply also. And it has also been very much strategic for voicing really the agenda for sanitation services and CWIS to the government of Nepal as well as the sector and also with other stakeholders as well. And bottom line,
Sudhaji, I think that's great points that you have raised. I think, sorry to pause you in between, but we are running a bit short of time, but I think very valid points that you raised about collaboration. I think Marina asked from the FIGA Foundation about how you can scale CWIS and how collaborations could work. So thank you for raising that great points. I would now like to move on to Alauddin Ahmed. So Alauddin ji, I think Bangladesh is known to attain ODF quite early when things had started to, and they had become open defecation free quite early. But yet the challenges remain around safely managed sanitation. So from CV's perspective, how are cities in Bangladesh transitioning from focusing only on toilets to ensuring the entire service chain? I think what Isha also highlighted, to look at the end-to-end solutions for CWIS. Good to hear your response, and if we can keep it short. Yeah, thank you.
Yeah, thank you, and I'll try to be on time. And you rightly pointed out, during the MDG era, our achievement that is 42% open defecation came to a ODF-free country by the end of 2020 was globally highlighted as well. Of course, we are proud of that as well. But during the SDG area, government soon realized that the traditional solution, that is CWIS, is not going to make Bangladesh achieve SDG 6.2 in any time. So one of the groundbreaking document then came out because of the advocacy and support by all the stakeholders, local and international, is the institutional and regulatory framework for fecal sludge management. That actually laid the path forward for the citywide inclusive sanitation. That's now being integrated in our national planning document, that is sector development plan from 2026 to 2040. As a guiding document for the sanitation sector, particularly urban sanitation. During the same time, in around 2018, the Gates Foundation also started coming in along with other IFIs and development partners. IWA was established as a CWIS capacity building hub in the region, and we started working with the government, build a CWIS ecosystem. Maybe I can highlight that a little later. And for citywide inclusive sanitation, the National Action Plan for implementing IRF FSM was approved by the government, which bring together all the municipalities as well as city corporations to implement what we call in the country's integrated waste management that basically lays on the foundation of citywide inclusive sanitation. At that time, several other things also came forward, like CWIS FSM support cell and other networks in the region, like FSM Network, NFSSM Alliance, and CWIS Network, from where we learned. And because of the advocacy and government willingness, now it is more than $2 billion investment has been secured for integrated waste management projects supported by ISDB, AIIB, AFD, World Bank, ADB, and all those fecal sludge treatment plant, FSM services are planned. One of the flagship program of government that initiated the CWIS, which was developed around the CWIS outcomes, equity, safety, and sustainability, with key indicators, key CWIS indicators built in within the projects to achieve, is the LLF 10 town projects, popularly known as ISDB funded projects. And that model has now been followed by most other project design, which call for a CWIS FSM action plan, including the GWSC principles in the projects, and required the sanitation bylaws to be developed, a financing or service models which is going to sustain, look forward to the occupational health and safety of the MTRs, and as you mentioned, the entire service chains, including the end product, which is what is going to happen. So this model is now being followed by the development partners, donors, government, of course, the municipalities. So let me stop here at this stage. And thank you.
Yeah, great. Thanks, Alauddin. And it's good to know about the scale up that is happening in Bangladesh across the sanitation service chain as a part of the CWIS program. So now from Nepal to Bangladesh, coming back to India, one of the largest country of the Asian. Over to you, Kaveri. So you also must have read the question. So such collaborative platforms such as NFSM Alliance have brought together government, civil societies, philanthropists, and technical partners to advance sanitation in India. So based on your experience, how have this kind of partnerships contributed to CWIS in India? And what is the most important learning while working with so diverse stakeholders?
Thanks for that question, Asim. And I think I speak on behalf of the Secretariat of the NFSM Alliance, which is a culmination and a collaborative platform of 30 plus partners based in India. Both Sudhaji as well as Alauddin Bhai have been very kind and generous to speak about it in such depth. But answering a little bit of your question, we all do know that with CWIS, the 3x2 framework that we're talking about, addressing each and every parameter on that is difficult without collaboration. And we, through the NFSM Alliance as the partners, have been trying to draw a lot from the framework and also be able to implement that in a collaborative manner across the different parameters. I think three parameters that I would focus primarily, or three levers with which the NFSM Alliance has been able to do that in India. I think the first one I would like to call out is a lot more on the policy as well as the government engagement piece, right? The NFSM Alliance was able to, one of the first wins back in 2016 was to be able to go ahead and launch the FSSM policy with and support the government of India a little bit more on that, which has led to the uptake in 24 states. So a collaborative effort of so many partners has been actually able to steer steer the discussion at a national level in a country like India. That has only been possible because of that. The second key example on the policy engagement side that I can think of is the more recent one, which is a cascade from the national policy to a state, which is the Odisha Urban Inclusive Sanitation Policy in 2024. Again, it was developed as one of the first of its kind policy promoting inclusive sanitation, participatory sanitation in a very sustainable manner. And we all do know that these are key features of the entire CWIS framework. The NFSM Alliance has also been at the forefront of advising the finance commissions, whether it's the 15th finance commissions or the 16th finance commissions, inputting into the SWAT Sarvekshan, or the indicators that are there for safely managed sanitation in cities. And it's sort of a competition of sorts. That has happened because of the collaborative expertise of all the partners across the technical side, across the community-based side, across working with the government as a technical support unit, so on and so forth. The second piece that I want to a little bit call out, which both Sudhaji and Alauddin Bhai spoke about, is a lot of the peer and the cross-learning that has been possible, right? Like, what are the best practices that are being championed at a particular state or city, and that can be taken to not another just state or city, but also another country in the form of a model. Definitely, there is a lot of contextualization that is required, and we've been able to do that through convenings, through, I would say, peer-to-peer support, through a lot of collaboration with other platforms and alliances, whether it's the Parvat Manthan platform, whether it is UN Habitat, whether it is ITN Buet, CWIS as an alliance, and being able to take some of that forward and showcase the India journey. The last bit that I want to just focus on, Asim, I see that we are also running short of time, is just being able to shift the lever on both of this has been a very strong and a very guided effort in terms of what is the knowledge and evidence that is required to be able to steer a framework as complex and as essential as CWIS. And that means that this collaborative of 30 plus partners have curated knowledge, looking at technical aspects, looking at the community aspect, looking at the policy aspect, and so much more in a very participatory manner, to look at some of the knowledge pieces, whether it's a Toilets 2.0 compendium, which looks at aspirational toilets, having a report on what does municipal strengthening look like, and also a little bit to support the sanitation worker agenda, especially during the COVID times, which was very, very required. So a lot of these across government policy, knowledge, as well as peer learning has happened through collaboration through the NFSM Alliance. So I'll just stop at that being the case point.
Yeah, thanks, Kaveri. And I think it's interesting to hear the India story as well. And now, from moving from a more local government-led service levels that have been followed in India, Nepal, and Bangladesh, we now move towards more of a utility-based model. So I now call out on Dr. Dorai Narayan ji. So at Waterlinks has undertaken a lot of CV's work around the regulation part in South Asian countries. So based on your experience, what role regulations play in enabling CWIS implementation, and what are the key regulatory improvements that are needed to further support it and scale up? Over to you.
Yeah, thank you, Asim, and good afternoon to everyone. To begin with, I think I hear some people calling this CWIS and some people calling it CWIS. Maybe CWIS is a much better term. It sounds wiser. So maybe let's all adopt CWIS as the standard term that we'll use. Going to regulation, I think this is something that I feel it must be a factor that must be recognized as something that will really drive the CWIS intentions forward, in terms of actual outcomes on the ground. The reason is that this sanitation is mostly in most of our countries, they are managed by local government. And these local governments have inherent challenges. They do many things and they lack resources, and they lack know-how, they lack capacity. So if we can have some kind of an overseeing arrangement, it is that will make a huge difference. And it can be either a formal kind of a regulatory arrangement, or it can be an informal one, because the formal one, we know from my work in some parts of India, it's not so easy to achieve a formal regulatory structure. But an informal one could be able to establish some kind of accountability, and also make clear the mandates that these local bodies have to take on. And they will also be able to set standards and kind of a monitoring of these standards of what kind of service levels are expected, what kind of equity is expected, the safety, and all these CWIS principles. And the regulatory arrangement could sort of nurture these utilities, nurture these municipalities towards achieving them. So it's not a matter of just policing, but helping them to hand-holding them to bring them up to that standard. And secondly, this also creates a kind of a better transparent environment where the private sector finds that the risks are less, and therefore they find easier to participate and bring in investment and efficiency and innovation. Yeah, and this is the example in Malaysia, which I think Azwan will speak about later, and also now in Nepal, which is also moving towards a regulatory framework. They have set up a regulator, and we will be able to see that to be replicated, something like what we have in Malaysia. So in the interest of time, so I'm going to stop with this. Thank you.
Great. Thank you, Doraiji. I think you raised a very important point about regulator and the entire model of formal versus informal, and it could be adopted in the local context. So before I move on to the next panelist, I would request all the participants to pose their questions on the Q&A box in case you have something specific for any of the panelists, or if you have a general question to the panelists and the presenters who spoke before. Moving to you, Azwanji, thank you for joining. So for your Malaysia, Malaysia has been one of the more established sanitation utility models in that region. So from your perspective of a national utility like IWK, what lessons can other Asian cities learn about managing urban sanitation services as an integrated and inclusive public service? Yeah, over to you.
Thank you very much, Mr. Alvin. Good afternoon, everyone. Let me just quickly start with a quick picture of who you are, what you're dealing with. In Malaysia, IWK in the water protector. Today, Malaysia is about 7,000 treatment plant, about 21,000 kilometers of land, as well as 33 million of population equivalent. And on top of that, we are also responsible to manage 1.1 million of individual septic tanks. So for us, that is quite a key factor of the CWIS, or what is the status of CWIS service thing. So if that's happening in under one national mandate due over the last 15 years. And the philosophy behind that, before I go to the three medicines, the philosophy that what keeps us running is actually a simple philosophy. No one is left behind. So with that, I would like to start with the first lesson, if I may. I think the key secret of what how it works in Malaysia is because of the mandate clarity. So that would be the first lesson. And I think I echo what was said in the poll that was done by me, actually the panel, in terms of collaboration being one of the top taken answer to that. And we see that in Malaysia, mandate clarity came after the industry reform that happened in the early years of the 2000s, where the Malaysian government took the first step to revisit the whole fragmented sanitation landscape.
Aswanji, can you come a bit closer to the mic? I think your voice is fading off and coming back. If you can be a bit closer to the mic.
I'm sorry, yeah. Can you hear me now?
Yeah, we can hear you. Yeah,
right,
okay,
sorry.
go ahead.
So I was just saying that, yeah, I think one of the key factors that make it work is that we talked about the mandate clarity through the industry reform that was carried out in the early 2000s, where the government established a landscape or ecosystem in which there's a regulator, there's clear parties to develop the treatment plants, the facilities, and there's a clear party, in this case, us in the water protector, who operates and maintain the sanitation systems for the public schools research. And I guess that helped to fuel few ambiguity or a lot of things that factors that fuels CWIS implementation in Malaysia previously, as well as in other countries. So that will be the first key takeaway, mandate clarity. Second one, I think, equal to that as well, is in terms of the financial architecture. And this is how we learned that in Malaysia we use a three-track model in a way that the federal government builds the large regional treatment plan and hand it over to the operator under a special 5-year budget. At the same time, when there's new development, new townships, the developer is also responsible to build small for that community treatment plan. To compare it from putting these two together, help to ensure that the inclusivity of the sanitation is very carried for new development as well as for the legacy development. So this financial architecture, we see it as a very important part, and it's closely regulated by our National Water Resources Commission, our SPAN, our regulator. And this helps us to build inclusivity first, and then we look at the financial sustainability. As a quick context, for us at WK, it took 28 years before we can free out ourselves from being dependent on government subsidies. And last but not least, a quick one, I think the third lesson is organizational restructuring, capacity building. We realized that over 32 years, we have to continuously learn. And this is a classic one because those who traditionally operate conservation ponds with more traditional treatment plants, as we move and evolve towards more modern mechanized plants, we have to upgrade our capabilities as well. And the good thing is that the lessons that we have learned, at one point we were mentees with many great operators out there. And today, after 32 years, we are now in the position to mentor other mentees in the region as well. So I guess that's the organizational restructuring and capacity building that needs to be carried out to the role of CWA. Or CWIS. So that's the three lessons, if I may.
Thank you, Azwanji, for you sharing your reflections and work. And we have been fortunate to see the Inda Water work. So we realize it's doing great work in Malaysia. Just one request before we come to you for the next questions. After some time, if you can try out a headphone because your voice is breaking and coming back. So just that request, if you can do that before we come back to you with the second question. So now moving back to Sudhaji. Sudhaji, can I have you? Yeah. Are you there? Great. Okay, great, Sudhaji. So, Sudhaji, I think we all know that CWIS has been emphasizing on reaching the poorest and the most marginalized. And that's theoretical also. But in practice, because you have been practicing, what are the main barriers that are being faced by cities to reach the informal settlements? So, if you can give a quick response to this, that would be great. Yeah. Thank you.
Thank you, Asim. So basically, all the policies that is from the Constitution of Nepal reflects the poor, service to the poorest of the poor. But the dilemma is that those practices, those statements, those commitments are not translated into the financial and budgeting. And there is no KPIs that really measures whether the local government or the federal government is really providing services to the poorest of the poor and the marginalized and the vulnerable that we always used to talk about. But like walking the talk is very challenging. And in context of Nepal, one of the other major challenges, all the basic services like water supply, sanitation, is linked with the land tenure and the citizenship. And if the informal settlements do not have that land tenure and citizenships, they are not obliged to have that basic services like sanitation services and water services. So most of the municipalities is really lacking proper services to those informal settlements as well. And in some municipalities, it has been served through like the public places, public spaces, healthcare facilities, and schools. But definitely they are not as eligible, legalized like recipient in this context. So in this context, basically, the political will is also there. It is not that the political rejection is there for inclusion and services, but it is the basic translating that into the planning process with monitoring mechanism, KPIs, and also the proper budgeting and the financing mechanism for servicing the all. So I think I would stop here. Asim, over to you. Thank you.
Thanks a lot, Sudhaji, for the points that you raised around how to ensure to mitigate the barriers. Now I'll move on to Alauddin ji. Great. Okay. So as an academic and a technical institution, which often plays a very important role in supporting cities, and I also being based out of a university and a research center which work with cities, how can organizations like yours and ours can better support municipalities with technical guidance, training, and evidence to implement CWIS? Because cities want evidence before they jump into something. So how would we work on that? It would be good to hear your thoughts.
Yeah, thank you for the question. Of course, ITN Buet with more than 28 years of experience in the WASH field, and as we work together with the sector stakeholders to create a CWIS ecosystem, what we call our CWIS ecosystem, where association like Municipal Association Bangladesh or FSM Network or FANSA was doing an integral part in the advocacy. But it started with the top tier, the ministry and the Department of Public Health Engineering and the utilities and the development partners like USAP, WaterAid, SNB, Practical Action, and importantly, the financial institutions like World Bank, ISDB, AIB, ADB, and TA Hub and GWSC, and all other our networks in the region. But all this need to come together in a circle where ITN Buet was accepted as a capacity building hub for CWIS in the country as well as in the region. And we started developing not only packages but also models for capacity building. And as you mentioned, the cities need to see evidence, first-hand evidence to start working on that and believing those. So we targeted all tier of the sanitation, starting from the city leaders, the decision makers, the policy planners, the city officials, and other private stakeholders and civil societies, including the ground personnel, that is sanitation workers, the masons, and those sort of things, and started different sort of packages, including training, including exposure visits, including dialogues, including symposium conventions, and products, audio-visual products for them to come together and learn and, of course, interact with each other and believe. Another milestone achievement through this journey was to build some of the cities that we call mentor cities, because not all cities have all the component of CWIS, but some were already working on where some cities are good at equity, some are on safety and sustainability. So whichever city had whatever CWIS component to showcase, we promoted them and made them a CWIS mentor city, what we called in the region in Bangladesh and Nepal. Now we have 8 established CWIS mentor city, and of course some other cities in India as well. We know our learning ground, as Sudhaji mentioned, in Hyderabad, Odisha, and Warangal, and all over the India. So these cities actually helped some other municipalities, altogether 330 in our country, to go and learn from their good practices and replicate. And ITN Buet just made sort of the bridging role and the connecting role, and wherever they need some seed support, so we provided that support, and based on that, government also came forward, and as I mentioned, government institutional CWIS and included it in our sector development plan. So by this, ITN Buet is working together to bringing CWIS and build the capacity on CWIS in the country as well as in the region. Thank you.
Great. I think thanks Alauddin ji. I think, and you raise a very valid point around how institutions like us could act as a bridge and not become the actual doers, but help facilitate the connections and all. I think it's a very valid point that our organization should follow. And we have been following, and we know that ITN Buet and others are also following the same. So great. I'll now move on to Kaveri. So Kaveri, when you read the report, and the report highlights some points around financing and institutional coordination, which sometimes become barriers for CWIS implementation. So from your perspective of philanthropic and impact organizations like Dasra is, where do you see the biggest opportunities for catalytic funding in urban sanitation? Over to you, yeah.
Yeah, thanks for that question, Asim. And you can also add, given CWIS's expertise in WASH financing. I would say that I agree with the report does highlight that there is a need to unlock greater government funding through fiscal allocations, particularly to be able to operate with a sense of urgency on the implementation for public financing. However, we also need to recognize that public financing alone will not be sufficient for it, right? Like we do know that some of the multilaterals, for example, we did hear Jitendra right now in terms of the ADB's role, in terms of World Bank's role, also the Gates Foundation's role, being instrumental in bridging some of these critical gaps. And that funding needs to be a little bit more um, I would say utilized in a more catalytic manner in some way. One of the things that I do recognize is this funding could actually be leveraged a lot more for strengthening the capacity of existing stakeholders to say what does the knowledge on CWIS that exists and what are like replicable practices that can be taken forward. However, we do see particularly with small and medium towns that there is a challenge in the capacities to be able to implement an approach as important and as complex as CWIS. The other aspect that I also want to call out is the role of, say, philanthropists as well as other organizations who are which is academia, institutions who are working at the adjunct of research as well as, are very closely related to the sector to be able to bridge that gap by funding innovations, by funding technologies, by funding alternate approaches to be able to streamline the device approach in a much more strengthened manner and taking some of that forward. I also see a gap there. And when I talk about research and innovations, I do not only mean in terms of just physical infrastructure, but I also do believe that there is a lot more research which is rooted in practice that can go out and that can be cultivated and farmed in terms of social innovations that need to be brought in, right? When we speak about social innovations, we do think of a couple of models, whether it is around, say, the SHGs, around certain best practices that we know in terms of the funding, in terms of the clustering approach. But what more? I'm sure there is a lot of wisdom that exists in this community. A lot of it does exist on this webinar itself that needs to be harvested to be able to look at funding in a more catalytic way, because we're always going to land up in this problem in terms of the funding crunch being there, and how that can also be used to not just strengthen infrastructure as such, but to look at service delivery, to look at operations, to be able to subsidize the cost for the marginalized who need the most, but also be able to look at it from a user who can afford to pay for some of these. So I think that those are some important points to be able to leverage funding for implementing the CWIS approach in a much more stronger way.
Yeah, thanks a lot, Kaveri, for sharing these points. And as you rightly mentioned, that at CWAS also we have been working extensively on mobilizing public funds, because that are the largest funds that could be accessible. But I think what we need to move forward is to look at convergence rather than just looking at independent programs. And what I feel that other types of funding that are coming from donors, they should act as a catalyst or a risk capital, I would say, because public money can't be used for risk has to come by somebody, and if it works then it can be scaled up by others as well. So thank you for raising that valid points, Kaveri. Over to you, Dorai ji. uh, Often capacity constraints limit the ability of cities to implement CWIS. So what type of training, peer learning or institutional support do you think would strengthen the utilities and the local governments to deliver the sanitation situation?
Thank you,
Over to you.
Asim. Yeah, thank you. I think the capacity constraints are not just at the city level. Of course, at the city level they are quite acute, but they are also at the national or state levels as well. And making the initial strengthening at the national or state level can be a big impetus to the local level. For example, what has happened in the last several years when we had Gates Foundation programs, where there were key people from different countries in Africa as well as Asia. They were brought on learning visits and exposure visits to countries like Malaysia and Philippines and other places where these are the decision makers and the key movers at the national or state levels. And when they could see what can be done, and they could sort of imagine what could be done back home. And over these years, you find that there were a large number of people who came, and there was a lot of spectacular changes which have happened in back in India and many countries. One of it is Odisha. I think that's a very good example that you can see, that people went back and then they started implementing things. Of course, it's not a question of a simple transplanting this what was seen here back home, but adapting it, right? So that's number one. And the second thing is that the capacity constraint at the local level is very, very difficult, and it's not a one-time or it's not a quick fix kind of a solution. So here I would think that something that can work better is to have a state level or the central level hand-holding program coupled with regulation, which I mentioned earlier. So if you can have some kind of either a formal or an informal regulation where the local municipalities' performance is measured through some indicators, and the weak areas, these are addressed by these technical support units. And these technical support units are going down to the ground to see what they need in terms of resources, in terms of capacity, and try to help them along so that everyone is able to move up, and it's a kind of a league table kind of thing, right? So the weaker ones are able to move up, and the stronger ones are able to help the weaker municipalities and so on. So this has been something that's been very successful in terms of mentoring. There's even a proposal now where we are trying to create a kind of hand-holding between the regulator, the newly set up regulator in Nepal, with the Malaysian water regulator, so that the regulator is also able to get the help of more established institutions like what we have in Malaysia. They have been in business for 20 years. They have been regulating, and so there's a lot of rich experience that can be shared with them. Of course, other types of specialized and other trainings, of course, those are indispensable as well. And maybe IWK might talk about that, because they have a very good program of developing people and skills for this industry. Yeah, thank you, Asim.
Great. Thank you, Doraiji, for sharing that insights. Now moving on to Azwan. So CWIS encourages utilities to look at its, again, CWIS is an approach, so it's not a technology or an option. I think that's a very clear message that we all need to take. It's an approach. CWIS is an approach and not a technology. I think that's a key thing that we all need to take back. So as a utility, as a regulator, when you talk CWIS, which encourages both seaward and non-seaward sanitation systems, what are the operational and regulatory challenges that arise when utilities expand their mandate to manage the full sanitation service chain? Would be good to hear your thoughts on that. Yeah, thank you.
Thank you, Mr. Asim. And I would like to apologize if I hope that everyone can hear me this time.
Bit better this time, yeah, but it's still wavy, but bit better, yeah.
Right. I'm sorry I couldn't find the right microphone to work with my computer at the very last minute, but I will try my very best. Okay, basically, it's a very good question in terms of the challenges that we face in terms of balancing between the steward and non-steward and so on. I guess CWIS is sometimes, being read as an upgrade everything to a modern standard. I guess we are also sometimes being challenged in terms of this technology ladder in a way that our sanitation story started back in the 1950s. So we had the pop flush toilets, big latrines, the more traditional treatment plants and so on. And the beauty about it is like the entire history is still present in our asset base today. And the important notion of this is like properly maintained, despite it being a traditional, if it's properly maintained, it can still be very much relevant. We don't need to modernize or to upgrade everything to a sophisticated solution at one go. So that has been the approach and the challenges, as well as the approach that we've been taking. What works, we will continue to use it. We continue to utilize what kind of technology is suitable for a specific location throughout the country of Malaysia. So in the modern cities like Kuala Lumpur and all, you'll be seeing all the latest, more modern treatment plants. But in the more rural or urban areas, we'll see solutions that actually work. For us, as long as people are moving up the ladder in terms of technology, one rung at a time, it's a technology that is fit for purpose and it works for us. Number two, I guess I would like to highlight in terms of echoing what Mr. Dorai has been sharing as well in terms of regulatory. What works for us in terms of addressing a common challenge, which is getting people to adopt sanitation. particularly for our septic tanks, where it is still a voluntary basis. What worked for us is actually using the regulation. A few years back, we worked with the government and the regulator to introduce what we call a scheduled dislodging, a regulation or an act that make it mandatory for every single septic tank out of the 1.4 million that we have in Malaysia to be dislodged at least once every 2 years or 3 years, depending on the location. So that has helped us to elevate the level of sanitation and the level of acceptance. Yes, it's a pull and push thing. It goes well hand in hand with a lot of good public awareness that is continuously being done. But what is more important is that those are the kind of challenges. Despite having regulation, people are still reluctant to enter the septic tank and so on. Lastly, I'd just like to probably spend a bit more time, maybe 30 seconds, to talk about one of the challenges operationally in terms of people, technology, and some extent again regulation. We approach people first because we believe that our people have been, with us. Most of us has been for the last 30 years, 20 odd years. So we cannot evolve whatever we are doing without upgrading our people. So a lot of times for Indah Water Consortium, IWA, we spend in terms of developing professionalizing the industry, upgrading our people. Most of them actually have not even received a formal education, but we've come up with formal structure to be able for them to appreciate what they do and of course to continuously learn so that we actually develop professionals within the industry. So this is, I guess, some of the challenges that we face, managing both steward and non-steward as part of our CWIS agenda. Okay.
Great. I think thanks, Ezwan. And we are running a bit short of time, but I just want one answer from all of you, all the panelists, only in one word. Which is the most important priority according to you that is most critical for sanitation beyond SDG, beyond the SDG timeline? Only one 5 seconds answer. Ezwan, maybe you can go first.
Well, I guess I'll go with
only one answer. Only one.
People.
People. Okay, perfect. Then Sudha.
For me, the data.
Data.
Evidence.
Perfect. People, data. Alauddin.
Inclusive sanitation.
Inclusive. Perfect. Dorai.
I would say innovation to address the needs.
Great. And Kaveri? Kaveri, if you're there. Okay, great. I think she's having some. Okay, great. I think great points. People, inclusivity, innovations, and financing and all. So great points raised by everyone. Hopefully we can have the next webinar around this, keep beyond what we can need to do. So thank you very much to all the panelists for sharing your reflections and points. It was a very interesting session. I hope the participants enjoyed the discussions and there were some key takeaways that you could take back to your work, to your field, and scale up CWIS as we move forward. With a one intention, we all need one intention to become CWIS in whatever forms we want to do. Thank you so much to all the panelists and the speakers. I'll now call upon Irma. She's from World Bank and she's a sorry, just 1 minute. Yeah, she's a senior water supply and sanitation specialist at World Bank. Over to you, Irma, for the key messages and the closing. Yeah, thank you.
Okay, thank you. Can you hear me clearly?
Perfect. Yeah.
Okay. Yeah. So thank you. It has been a privilege for me to be part of this conversation today and listening to the very interesting conversation and presentation. So as we close, I just want to reflect briefly on what we have heard and why it matters not only for this webinar, but also for the broader trajectory of sanitation, both in Asia region, but also in globally, right? So I think from today's presentation and panel discussions, it reinforced a core point that Citywide Inclusive Sanitation, CWIS, is not a technology. It is an approach to achieve one objective: universal access to safely managed sanitation. It may go by different names in different places, but the philosophy is consistent. Plan for the whole city, serve every person, and manage the entire service chain so that sanitation is safe, reliable, and sustainable. We are also seeing growing evidence that this approach can deliver system-wide results at scale in dense urban cores and in communities that formal systems have historically overlooked. And when governments, utilities, development partners, and other stakeholders align around a shared framework, that alignment can translate into real change for real people. At the same time, the message today was also clear that we must continue and we must go further. CWIS is increasingly being applied across regions, and not only in large cities. It offers a flexible and inclusive framework for small towns, secondary cities, and a wide range of settlement types, often the very places where sanitation challenges are most acute and where conventional approaches have fallen short. The sanitation crisis is not confined to megacities, and so our solutions also cannot be either. CWIS must also keep evolving to meet future challenges, including the climate change. That means we need to strengthen our documentations and the evidence base. We need to continue to build public awareness and integrating sanitation more deliberately with urban planning and climate resilient service delivery. It also means investing in people and institutions. Countries and cities need capable actors within governments, utilities, communities, and the private sector who can design, regulate, finance, and deliver the services. Projects funded by loans and grants should be complemented with sustained technical assistance, and resources should support networks and knowledge institutions. We have to expand university teaching and research. We have to strengthen our consultant and practitioner skill sets on CWIS governance and service delivery. This is also, I think it is a time for me to kind of like share with you that the World Bank has formally recognized CWIS as a priority scalable solution within its recently approved Water Forward Strategy Implementation Plan. This signals commitments at the highest level, a recognition that CWIS is not simply a pilot to be tested, but it is a pathway to pursue with ambition and speed. And it is meant to be implemented alongside a broad coalition of development partners. No single institution, no single government, and no single sector can solve the sanitation crisis alone. The path forward requires stronger partnership, more programmatic approaches, and sustained collaborative learning so we can adapt and improve as we go. So what should we take away from this webinar? I would offer 3 points. First, confidence. The framework is sound, the evidence base is growing, and countries and cities that have embraced CWIS are demonstrating what is possible. Second, shared responsibility. The scale and speed required to meet global sanitation goals will only be achieved if we move together. Governments, development partners, civil society, all of us at the center of all. Third, urgency. The sanitation challenge is transformative in scope, but it is also deeply human. Every day without safe sanitation is a day of lost dignity, loss of health, and lost potential for individuals, for communities, and for economies. So we have tools, we have evidence, and increasingly we have institutional commitment. What we owe the people we serve is that the will to act at scale, at speed, and with the cross-sector collaboration this moment demands. So let me close my remarks with a quote that Francois mentioned. If we want sanitation for all, we need to do all for sanitation. So thank you.
Great point, Erba. That's a great concluding remark and a point that we need to take back. So I think we are coming close to our session. We are almost on time. Thank you, everyone, to all the panelists and the speakers for joining and for sharing insights about your work across Asia. I would like to thank all the participants who have stayed back and have shared and have responded to the questions. I would like to thank all the speakers who have responded to the questions. Unfortunately, we could not take any live questions, but I see that most of the questions have been answered. But in case something have been missed, we will come back to you. And all the materials related to this, the presentations, the discussions, they will be shared on the IWA website and we will reach out to you. So thank you once again to all of you. Thank you IWA for making me the moderator for this session. Thank you everyone. Thank you all and look forward to having you. Just one point I want to have the intention to make your work CWIS and it will work. I think intent is important. Things will fall in place. So great. With this, thank you very much.
Thank you, Asim, very much. Thank you.
Yeah.
Thank you very much for this. And I would like just to say thanks again in the name of IWA to everyone here, especially also to you, of course, to the panelists and to GWSC AIT with whom we are organizing this. Just a few information. We're going to go on we're going to go on with organizing this type of activities together with AIT, and maybe on the very much more specific activities. There's already a call to organize something on the sanitation workers. So we will look at this, of course. I want to inform you also that we, all this, the people are here together, but also with others, we will be organizing a network, trying to exchange more information. Today is the first one we have been organizing. We need to build a momentum around this. And also, I would like to tell you that IWA will be organizing a sanitation summit in January in Cape Town, South Africa, next year in January. So thank you very much for this. I wish you all the best. Thanks also to Florence. Florence, you wanted to give a few information as well. Thank you.
Yes, I hope you can all hear me. Thank you again, everybody, for your time as we wrap up. Just a quick reminder that the conversation do not end today. So be on the lookout. We have some webinars that are upcoming, as you can see on the screen, and also we have our upcoming events, the Leading Edge Conference on Water and Wastewater in Houston, Texas. We have the IWA World Water Congress, our flagship event in Glasgow, UK in October. We also have the Digital Water Summit that will take place in Istanbul in November. And finally, if you're not yet part of the IWA community, we invite you to join us. Please take advantage of the membership offer that we have that is highlighted on the screen. Simply scan the QR code or visit our website to learn more. And yes, we come to the close of today's session. Thank you all for joining us today, for your active participation in this webinar. Your insights really have, and questions and engagement are what make these conversations meaningful. Of course, one thing is clear, that progress is happening, and we still need to do more to accelerate progress towards 2030, but also beyond. So we take this opportunity also to extend our sincere thanks to our moderator, Asim, and also all the presenters, the panelists, the co-organizers of this webinar who have been AIT in Thailand, as well as the specialist group on sanitation and water management in low and medium income countries. We really appreciate you collaborating with us to organize and deliver this webinar, which we believe has been a success. Remember, sanitation is not defined by by the solutions we build, but by how well those solutions serve every community, so that we reach everyone with safely managed sanitation in every context. We look forward to seeing you in our next webinar and also other upcoming events. Until then, please take care and let's stay connected. Thank you.